Hello, everyone, and welcome to all. I'm David McCreary, Director of Major Gifts at Northwestern University Feinberg School of Medicine. We're genuinely pleased to have each and every one of you with us this afternoon for a discussion among leaders of Feinberg's expansive and impactful Institute for Public Health and Medicine. We're grateful to those of you who submitted questions when you registered. This afternoon, additional inquiries may be submitted during the event, which can be done through the Q&A button on your screens. Our speakers will do their best to respond to these questions as time allows. Our discussion will be led by Dr. Ron Ackerman, Senior Associate Dean for Public Health at Feinberg. He's director of both the Institute for Public Health and Medicine, as well as the Center for Diabetes and Metabolism. Ron's a national expert on the prevention and control of diabetes and other chronic conditions. Dr. Ackerman will be joined by two dynamic colleagues, Dr. Ruchi S. Gupta, Director of the Center for Food Allergy and Asthma, and Dr. Darius Tandon, Co-Director of the Center for Community Health. Dr. Ackerman will share more about both of these talented professionals. So now let me get out of the way so you can enjoy the insights of these experts and learn a few things about public health and medicine at Northwestern. Ron, it's all yours.
Thank you so much, David, and thank you everybody for the opportunity to share some of the exciting activities that are happening within Feinberg School of Medicine and specifically our Institute for Public Health and Medicine. We really appreciate you sending advanced questions to us, and we'll try to address some of those in some remarks that we're going to share with you now. You are invited to post, as Dave said, additional questions at any point in the presentation. Please use, again, as David said, the Q&A function at the bottom of your Zoom panel, not the chat function. We'll be monitoring the Q&A, and I'll try to get all the questions addressed. We really want it to be a dialogue. We have prepared some slides to organize some information we thought you might want to hear or we'd like to share with you that helps to facilitate the conversation. And then we're going to talk about some specific examples of work that's happening in the centers that are directed by Drs. Gupta and Tandon to really work collaboratively with communities to try to address the impact of the COVID-19 pandemic. So with that, we'll turn just to a few introductory slides to orient you to what is public health and medicine at Feinberg and what makes it unique. This is just a title slide. We'll move to the next. I think it's helpful to have just an orientation. Many people, know that Northwestern University's been around a long time, know a bit about the medical school, but don't really know about the roots it has in public health. And I think it's important to understand this. So just very briefly, the Chicago Medical College was established in 1859. It was established by faculty from Rush University who really were advocating for a longer and more rigorous medical training that wasn't really the paradigm at that time. And they broke off and partnered with nurses at Mercy Hospital system to develop this new medical college with a mission really around rigorous training and charitable healthcare. And the health issues of the time, as you imagine in the 1850s in Chicago, related to largely infectious disease public health epidemics like cholera and influenza and a variety of others. And the school was very instrumental in addressing those in the city. This is the original building here on the corner of Wacker and Randolph Street. It's now, of course, a high rise. And over time, the medical school moved south and actually avoided the fire in doing so, the Chicago fire, by being located on the Mercy Hospital campus for almost 70 years. And then in 1920s, with the dedication of our Chicago campus, where I'm sitting today, Northwestern University School of Medicine was established with really a new physical footprint, and it included a Department of Social Service, also a commitment to free healthcare. There was a free clinic right here in Streeterville. and a vision for greater impact in Chicago. By the 1950s, faculty had organized themselves in areas of sort of the science of epidemiology and understanding patterns of disease and using it to direct policy and practice. And they, in that work with medical students and a few key faculty, established at Erie Neighborhood House a free clinic for the first time, which is the forerunner of the Erie Family Health System, which remains a strong federally qualified health center partner of the academic institution. Those faculty went on to establish the Department of Community Health and Preventive Medicine. And it was within that department that several years later, that the sort of the impact or the activities that related to community health and epidemiology were expanded to training. And we graduated our first Master of Public Health. So really training the workforce that would go out and lead and to use research to drive and inform thoughtful public health activities. That sort of those activities and our research portfolio have all continued to grow within the Feinberg School of Medicine in various ways, both in the health system and in the community. And in 2012, many of those were organized for the very first time together in the vision of a multi-departmental institute, an institute that would work across departments and schools at Northwestern to really work on bringing people out of their departmental silos to work in multidisciplinary, collaborative ways, and increasingly with communities to try to design research and service activities and also training in ways that didn't just benefit publications and grants and the prestige of the medical school, but had real benefits on practice and policy and the health of people living in communities throughout Chicago. So we're going to talk a bit about that briefly. I want to share with you the organization of the Institute. And to begin, next slide, this is really, to the best of my ability, our Institute on a page. And it's important to understand the scale. It engages 500 faculty members from 51 departments and 6 schools throughout Northwestern. Now, most of those are at the School of Medicine, but we collaborate very avidly with other schools that are experts in fields of engineering and communication and anthropology and a variety of other areas that really are important for research and action in public health and in policy. So it's large and it's diverse and it's spanning. And our research portfolio in this area is quite large. Those 500 faculty members currently have about $211 million in extramural funded or outside funded research activities. Not all of that is in the community, but it is really research that's classified as clinical research or research that's in public health settings, in health care settings, or in the community. We organize that work and all of those activities, the research and the training, in thematic centers. And Dr. Gupta and Dr. Tandon, who are with us today, direct 2 of those 16 centers in IFAM. We do this because faculty member within these centers share either partners, funding sources, approaches to their research, or goals that when they work collaboratively, often sitting in the same space, but also collaborating virtually through non-physical means, they are able to get more work done. They're able to do more diverse activities and also have stronger impacts. We also operate an increased training program. I talked before about the first Master of Public Health student in 1974, but we now have 4 master's programs at Feinberg that are within the Institute for Public Health and Medicine, as well as a integrated PhD program. And it includes, in the Institute, there are collectively 244 students and trainees. And increasingly, we've tried to develop really service learning or community engaged learning approaches. And that's also extended to the medical school training as we partnered with the medical school offices to really try to embed some of the medical school training in communities. So this is a lot of organization, a lot of facilitation, a lot of support that we provide in the Institute. And it was timely when we were faced in March 2020 with our first sort of cases of COVID-19 in Chicago. So I'm going to pivot a bit to that and talk, just make a segue here to how this robust sort of entity of the Public Health and Medicine Institute was able to help us to support activities of faculty and our partners throughout the COVID pandemic. Next slide. So not to talk about these in detail, but I want to point out that our 500 faculty members and the work they do came to a screeching halt in some ways. It didn't stop completely, but the focus of it really became quickly immersed in COVID-19 in March. And many people said, what can I do to help? And so everything from surfacing data and working with public health partners to join and integrate data sources from public health surveillance and health systems and other community level data sources like hospitals and clinics, and even in the supply chain and things that were rapidly evolving early in the pandemic. It was a data challenge, and without data, we couldn't even begin to understand how big the problem was, or where the sort of patterns were, or where it was heading. On the development of those data relationships and agreements, we were able to have some faculty work on modeling. And I would just say that none of these people were really working in coronavirus areas prior to the pandemic naturally. And so they all sort of continued to operate as faculty members doing what they were doing, but took on a lot of these COVID-related activities. So infectious disease modeling, and those models were used by the Illinois Department of Public Health, as well as local health departments and the governor's office, and continue to be, in addition to other data sources, to try to inform thoughtful policy that's based on data and evidence. We had faculty members who jumped in and really challenged the ethics of distributing resources and supplies and sort of support for communities and people that that really were being treated inequitably early in the pandemic, and try to understand the ethics of our response and how to be more balanced in our approaches. We had faculty that are experts in stress and coping and mindfulness, develop interventions that would address the burden on health systems and staff and people in communities who are at the front lines of the pandemic. We had researchers who had existing studies, and Ruchi will talk about some of those today. I think Darius may as well, but they actually were able to start to collect additional data from existing studies that helped us learn about the burden of COVID-19 on vulnerable populations like older adults. And our epidemiologists, one of the strengths here at Northwestern, who focus a lot on cardiovascular disease and other areas, typically really dug in and focused on the patterns of disease and where that was headed, throughout the pandemic, and now with vaccines and the current patterns of disease progression as we move forward. So really just emphasizing strengths across multiple areas, really working collaboratively in new ways to try to help in any way possible. We also invited public health leaders in and put them in front of the Institute, and allowed our faculty to interact with the director of Illinois Department of Public Health and Chicago Department of Public Health. And we even embedded some faculty members, in the departments to help with the informatics or the epidemiologic response and response systems that were being developed. So, Feinberg in general had a big impact in the Chicago area, within the state, and even globally, as the pandemic developed and evolved, and we continue to do so. And a lot of that is organized and really facilitated by the structure of public health and medicine within our campus. So with that, we want to turn our attention really to the community and to how this has impacted communities, or how we've worked to try to center on the voice of communities and work collaboratively with communities around their needs in the pandemic. A lot of this won't focus really on just the research we do, but really on service and on other forms of support. that we were able to develop collaboratively with community partners. And we wanted to serve as a dialogue for conversation about where it's headed and where there might be opportunities for deepening those relationships moving forward. So we're going to spend just a couple of moments talking first about the Center for Community Health and how that's organized. And then we'll talk about the Center for Food Allergy and Asthma and how that's organized. And then we're going to come back together and give some additional examples of how those two centers and the unique approaches they have focused on working with the community on the COVID-19 response. So with that, I want to maybe turn it briefly over to Darius to tell us about how community health operates here at Feinberg. Next slide.
Thanks so much, Ron. So thanks everyone for tuning in today, and really excited to be able to share a little bit about the work that we do at the Center for Community Health. As Ron mentioned, there are multiple centers within IFAM, the Center for Community Health being one of them. And our mission is stated here on the slide. We are in the business of trying to make research more meaningful and impactful to key community stakeholders throughout Chicagoland region. How do we do this? We do it by building resources at Northwestern to support community academic partnership that equitably involve community stakeholders. And I want to just unpack that second bullet point for a second and really highlight this idea of community academic partnerships. So some of you may have heard the term ivory tower, research, and that is what we are trying to avoid. That is what we are trying to get away from. We are trying to say that research is best done in collaboration between researchers and community stakeholders. And there are many ways in which community stakeholders can contribute to designing, implementing, help disseminating findings from research. So that is what we are in the business of doing, trying to promote community academic partnerships. And in terms of building resources or developing infrastructure to do that, we really do it by trying to develop capacity both among Northwestern researchers. So how do researchers identify stakeholders? How do they engage effectively with stakeholders? What are best practices and processes for working alongside community partners? And for community stakeholders, many of them may not have much experience working alongside researchers. So how do we develop their capacity to be equal partners and not just symbolic partners in the research that we're doing? The map that you see on the slide shows visually the 500 plus community stakeholders that our center has connections with. And what you see here is that we have those connections throughout all parts of the city. So one of the other things that we are able to do very effectively is if you are a Northwestern researcher who is interested in working in a particular disease area or a particular geographic area, we at the Center for Community Health are able to facilitate some of those linkages to community partners. Next slide, please. So a little bit about the impact of our center. Through a variety of different grant programs, we have funded over the last decade over $1 million in seed grants for community academic partnerships. And many of these partnerships have gone on to obtain larger NIH grants, foundation grants that are really doing the community academic partnership work that we are hoping to see. We also provide a great deal of education and consultation for faculty who are seeking to engage more deeply with communities. So as I mentioned on the previous slide, a lot of the work that we do is trying to prepare and equip faculty members to engage in an equitable, collaborative fashion with community stakeholders. We've worked with over 300 faculty from 15 departments within Feinberg in terms of providing that capacity building for researchers. And we also do a lot of work helping research to disseminate research innovations and also evidence-based practices into community and clinical settings. So we know that a lot of programs, services, interventions work, but how do we get those programs, services, interventions into community settings? So that is another big part of the work that we're doing. Next slide, please. So along with developing capacity for community academic partnerships, we also have core faculty that are situated within our Center for Community Health. And these are 4 of the faculty that sit within our Center for Community Health. So Dr. Nami Kandula is a colleague who does work addressing cardiovascular health disparities in the South Asian community. I do work in the area of preventing postpartum depression among racial and ethnic minorities. Ron mentioned in his introduction the idea of sort of pivoting during the COVID pandemic, and that is certainly something that we have done. A lot of our intervention work that was previously done in person, we are now training service providers to deliver our postpartum depression interventions virtually around the country. Marquita Lewis-Thames is a new faculty member who has a really interesting portfolio of research around improving access to care among rural populations experiencing chronic disease. And finally, Matt O'Brien is a faculty member who does a lot of amazing work throughout the city, particularly around eliminating health disparities related to diabetes among Latinos. So just a snapshot of some of the work that faculty members within our center are doing. And we'll look forward to answering questions that you may have about our center and our faculty work later on, but I will pass it along to Dr. Gupta.
Thanks so much, Darius. So I'm Ruchi. I am the director of the Center for Food Allergy and Asthma Research. And just a little bit about that, I've been working in this space since I joined Northwestern 17 years ago. And while I was studying it, my own daughter was diagnosed with food allergies, so it's highly personal and very interesting. So as a physician and researcher and mom, our focus is really on better understanding, the public health impact of food allergies, and asthma. So the epidemiology, so how many people have it, what is most common, how severe does it get, what are the disparities in it? How are people's quality of life while dealing with it? So all those, day-to-day aspects of dealing with these diseases. And then also we do a lot of clinical research. Big portion of our clinical research is prevention. So how do we prevent atopic conditions? So that march, that eczema going to allergies, both environmental and food, and then onto asthma. So we focus a lot in that space. And then community and school outreach. This is really important to us, really helping to develop policies and awareness campaigns and tools and kits that schools and communities can use to educate themselves about the condition, and then also how to manage it and treat it. Next slide. All right, so of all the things we do, I just wanted to point out a couple of things that I thought would be of particular interest. So this is something, during the pandemic that really came up. There was so much food insecurity in the country, and you saw those long lines at food banks and to pick up food. And a big question that came during that time is, what if people can't eat foods, right? What if they have a food condition? And that can be, food allergies, intolerances, celiac, eosinophilic esophagitis. I mean, there's so many conditions around food, and that may prohibit people from eating what comes in that pre-packaged pack that you get. So how do we address this, and how do we make sure families, children, adults who have a food condition and food insecurity are getting adequate food and nutrition? So this was a paper we wrote and started working on to try to really understand the situation and what we can do. And we partnered with organizations to help spearhead getting safe foods to families with food insecurity and food conditions. Here you can see the chart. 32 million Americans have food allergies, but about 85 million Americans have a food condition. And then 11% of US households are food insecure. And then these are 4 of the areas that we were focused on addressing. The map on the other side is a map we developed to look at asthma in Chicago. So we know asthma rates are higher in urban centers. They are high in Chicago. Almost 10% of kids have asthma in Chicago. But what's really interesting is when you map it by neighborhoods, you see differences in neighborhoods that are right next to each other. So the green is low rates of asthma. The pink and red are very high rates of asthma. Pink is 20 to 30 and the red is over 30. But in some places you can see pink neighborhoods right next to green neighborhoods, or red neighborhoods right next to green neighborhoods, yellow neighborhoods, and pink neighborhoods. So this started this quest for What is it? What's going on in those neighborhoods? Can we predict different environmental factors, different community factors that may be influencing asthma, both in a protective way or in an increased asthma way? So this was a very important study that led to many interventions in Chicago schools to help kids be the leaders in better understanding their own communities. Next slide. So as we move through this, it's been really exciting to see people who come forward in the community to say, well, it would be really great if you could do this. And that's been wonderful. So for any of you listening, if you have ideas or thoughts on things that are needed, where are the holes, what's missing in the community in terms of resources or education, or let us know, because that's really where we get the best ideas, is from people in the communities living with conditions every day. And so what we did, based on feedback we got, was create a video library of educational food allergy and asthma videos for all ages. And the asthma ones are a lot of fun because we went into schools and worked with students, and they created the PSAs around asthma. And then they would show it to their schools and their families, and we would get press on them. And it would just lead to them being very empowered to be able to not only manage their own asthma, but to speak about it and to be advocates in their community. We made food allergy videos. Again, these were all kids with food allergy. We made one for elementary school, middle school, high school. Then, an early child care professional came and said, well, you don't have anything for preschool and daycare. So we created that. And now that is being used in Illinois to train daycare centers. And then we just completed a college one because they said, well, there's nothing for colleges. And a lot of these kids are independent for the first time in college, and they're embarrassed to tell their friends. So we just created one for colleges, and Northwestern is going to pilot it, Northwestern University, in the fall. We also listened to the community when they said, these conferences to educate us are great, but what about our kids? What's gonna, can you help us teach them? So we've had the Midwest Faces Conference, which we hold yearly. Unfortunately, last year it got canceled. We'll see what happens with this year. But the goal of this is we have a teen room, a kids room, and a parents room or caregivers room. And each room is facilitated and by, the same, like physicians go to each room, because the kids should talk to doctors, and ask their own questions to themselves. And so, but what we put together for each group is age appropriate, and the kids have so much fun. They even get to use expired epinephrine autoinjectors into oranges to decrease the fear of using those. So there's a lot of really fun stuff, and it's so rewarding for us to be able to work directly with families and with kids. And then the third program that's listed here is, again, something that came about. How can we support and empower Chicago school children with CPS and any school children across the Chicagoland area who are interested in health and health careers and wanting to change health in their neighborhoods and communities, to bring them together, to empower them not only to believe that they can, but also to give them the skill set to pick up a condition that's prevalent in their community and then go out and do something about it. And, the conditions that they pick them. So, food allergy wasn't even on there. Asthma was low on the list, but made it. And then the biggest condition that they picked was mental health. And then many other things related to that or around that. But it was fascinating to see what they did about it and how they created interventions for their communities to improve it for their community: awareness, education, and resources. And so it's a very exciting program. We did it once and then again missed it last year, hoping to start it again this year. Next slide. These are just some of our large research trials, iReach and SEED. This is NIH study to really improve. One big thing about research is we do the research, we publish the paper, but how do we translate it and get it to the community, get it to the people who need it? So one big thing that happened in prevention was we went from don't eat peanuts early to eat peanuts to prevent peanut allergy. But what we found is that this information is not getting to the public. So iReach is to help pediatricians, give them resources, give them information, put it in their EMR so that they can tell families about it, and families will do it. And so trying to see how we can streamline good data that may prevent disease and get it in the hands of the people. Another one is asthma management through technology. So taking your inhalers, you know, it's quite complex. It's hard to remember. And you have two kinds, your controller and your rescue. And so how can we help support families in making sure their kids are taking the right inhaler at the right time? And this was the sensor that you see starting to be put on top of that inhaler, which has a Bluetooth sensor which records what you're doing and sends it not only to the caregiver's phone, but also to their physician's office. So physicians can keep track of whether it be their pediatrician, their allergist, their pulmonologist, their family practitioner. You know, they could keep track of what's happening with that child and intervene if needed. And then the Forward study is another NIH trial looking at racial and ethnic disparities in food allergy development, which has not happened before, to really look at differences by race and ethnicity. Next slide. Okay, I think here I'm going to turn it right back over to Ron.
Yeah, this is, so up till now, we really wanted to give you a picture of how we're organized and the various ways in which centers within public health and medicine here at Feinberg have tried to, you know, center the voice of community partners or people with lived experience to inform the research, to help us ask the right research questions, to collaboratively design research studies, and then ultimately to make sure that the findings are back in the hands of those that need the results to either make policy decisions or provide care or care for themselves. So, you know, that we can come back, I think, to that. I think that that's a valuable thing to, you know, we've given you some example. You know, some of the questions that came in ahead of time were, are you doing this in healthcare settings? Are you doing this in aging populations? And all of that is yes. We have various centers that do that for different reasons. Some focus on technology, some focus on care process, some focus particularly on vulnerable populations. And we can come back to that. I think that the purpose of this point is really just to give you a glimpse at the type of work that's happening. And I think on that note, what we wanted to do is just have maybe just a couple more slides about specific activities that are really unique. They're really not necessarily just research or things that are sort of derivations of what we were already doing, but they're unique activities that came about really to address COVID from the perspective of communities. And there are certainly ways to continue to deepen these and to improve them, but we wanted to share some activities that I think highlight Feinberg's work in the community in unique ways that probably wouldn't have been happening if it weren't for some of the folks on the webinar and the collaborators they have through their centers. So we're just going to share a little bit more information and then maybe come back to dialogue. If I could have the next slide. Ruchi, Ruchi is going to take us through some of these activities first, and then I think Darius, and then we'll end with one final slide. So Ruchi, why don't you take it from here?
Sure. And I think this is great because all of our centers, although we are somewhat focused, we pivot, and we should, based on what's happening in our communities. And this is a really great example of it. So the first one is the HEROES study. And this was just such an interesting immediate study that happened where the NIH called one night and Northwestern and even Lurie Children's went into action the next day to make this study happen because it was so important. And it's called the HEROES study. And what it is we were looking at families in our cohort. So they were looking for places that had already cohorts of families and children for other studies that they could utilize for a COVID-19 study. So this was really great because we were able to utilize that forward cohort that I mentioned, looking at disparities in food allergy, as well as the eye-track cohort, the one with the sensors for asthma. And we invited all those families to join a COVID-19 study. And these families received a box with supplies. They learned, took their own blood, they did their own nasal swabs, they collected their own microbiome, and they sent it back to us. They completed surveys so that we could do surveillance around COVID-19 with these cohorts. And that was it was a really interesting experience because we were one of 19 centers across the country following groups of kids and families to really understand the spread of COVID-19, symptoms, microbiome along with that, and all kinds of quality of life issues. Another one that we jumped in on was with the Chicago public school system. You know, all of this was happening so fast. It was a ton. So we reached out to CPS and said, hey, is there anything we could do to support you to understand what's going on with your families? And so they agreed immediately. We got to work putting a survey together to understand how families were doing in CPS, and that we published, you know, the mental health impact for these kids, and you know, things that were protective and things that we could do. So that was a paper we recently published. But then we also joined a grant with some infectious disease folks over at Lurie Children's and Chicago Public Schools and the Archdiocese to really look at a longitudinal survey and also testing and vaccine access, psychosocial impacts, and outcomes of COVID-19. So, you know, there were quite a few things that we were working on, especially with the school systems, and we have such a great relationship with them that when we did launch this last Chicago Public School COVID-19 survey, you know, we had a lot of our staff even become CPS volunteers to be able to call families, underserved families, and try to get the completion rates up, and you know, get Spanish speakers from our team to contact families. So you know, we all jumped in together and went to work to better understand what was happening with these families and how we could best support them. Alongside that, we created a mental health website and app for families, and we're trying to get that into the school system to support families with resources, you know, that are publicly available, but we're compiling them so that it's easy. If they tell us what the issues are they're having at home or with their kids, that we can send them to the best resources that have been vetted by our psychologists at Northwestern. So very different than what the mission necessarily is of our center, but so important to be able to pivot and have the support of the university to be able to do that.
Next slide.
Yeah. Darius, I think this is yours.
Sure. So one of the other things that we wanted to highlight was a collaboration between the two centers, Rucci Center and our center, that provided 28 response and recovery grants to community-based organizations throughout the Chicago area. So many of you who are joining us right now, I'm sure you appreciate the fact that community-based organizations are the lifeblood of many of the neighborhoods throughout the city of Chicago, and do a wonderful array of work in these communities. They also are many of the partners that we work with on community academic partnerships. So we wanted to figure out ways in which we could support these organizations during the pandemic. And many of them were struggling to meet the needs of the clients and the populations that they were serving. So we don't have time to go into detail and show you all of the 28 funded community-based organization. These are the logos of all of them on this slide. But if we turn to the next slide, we have a few examples. And I'll highlight the first two. The first is the Boulevard of Chicago that provides shelter for chronically homeless individuals who are over the age of 60, and also Black Girls Break Bread that focuses on addressing maternal and infant mortality in Chicago's west and south sides. So I should say we prioritize these response and recovery grants to be focused on issues of housing and food instability, mental health, also a priority to serve immigrant and refugee populations. So the first two were really agencies that we, the Center for Community Health, supported, and I'll let Ruchi talk about the bottom two.
You're on mute, Ruchi.
Sorry. Okay. I hate hearing that. You're on mute. Must hear it like 10 times a day. All right, everyone. So thank you for that. I was just going to highlight two of our community partners and grants that we gave. One was to the Greater Chicago Food Depository, coming back to that whole idea of food insecurity and food conditions. So we did donate to them, and they were incredibly appreciative, considering how hard they were all working. We also developed connections with them. So now we are working, as their demand slows down and they have more time, we do want to work with them to better understand what their needs are and what food conditions are important to them or that they serve in their community. So, and the other one was the Food Equality Initiative, which that is their mission, to provide safe food to everyone with food conditions and food insecurity. So not only were we able to give them a community grant, but then we got to know them a lot better. And we just wrote a research grant with them to better understand how we could work with them to identify people with food insecurity and food conditions and send them food and measure it based on how many food reactions they have and their quality of life, so that we could potentially work towards a policy with food as medicine and influence groups like WIC to be able to provide more allergen-friendly foods to families and to kids. So really excited about the work we've been able to do in the community with these grants, not only by helping them out with funds, but also partnering with them in the long term.
So with that, I'm going to turn to some of the questions that are coming up, and I think there are a few that relate to things that have already been said. So I think I'd like to turn them to Darius and Ruchi. One is really about how the last year has really turned everybody's attention or enlightened many people who weren't really thinking about it regularly, that health disparities are everywhere. And, there's a inequitable burden of many health conditions. You've described many of them. You've shown maps that sort of show a predominance of health problems in Chicago's communities that are predominantly African-American or Latino or Latinx, that are poorer communities. How are each of your centers fundamentally approaching that issue? And I guess the way I interpret the question, part of that is really, not just project by project, but what really is the issue in terms of social and environmental and structural issues that underlie a lot of those disparities. And they bubble up as health problems that are sort of the focus of some of our research projects and our other activities and our partnerships. But how are we fundamentally addressing those social and as to the root of the question, racial disparities in the city?
Yeah, it's a phenomenal question, and also a challenging issue for us to address at a center level. I think one of the things that we have tried to do as a center is in many cases sort of raise this as an issue to faculty who are doing work in communities and encouraging them to think a little bit differently about the approaches they're taking to doing their work. So instead of doing an individual level intervention or a group level intervention, or doing work in ways that folks are more accustomed to, really encouraging folks to think about what are some of the social determinants that may impact the health issue that you're examining, and challenge folks to think about ways in which their work can help to break down some of those, those barriers. I think it is a long road ahead to really be able to address these issues. But I think if we can raise, the consciousness of investigators to be thinking differently about how they are developing their projects, and also, and importantly, trying to figure out ways to build infrastructure into research projects, so that there may be ways to support work that is happening at a community level to address these issues. I think these are all things that if we can have a number of investigators all working together incrementally, we can collectively try to move the needle.
I totally agree, and that is exactly right. What Darius mentioned. What's really exciting, I think, for all of us as researchers is that when we started, when I started 17 years ago, there wasn't a lot of emphasis on community research, and now there is. And like I said, it's great to have the support from the university, from Northwestern, to go into the community and do this very, very important work. A couple things we're doing. We just started a community advisory board. So if anyone listening has any interest in it, we are trying to establish. I see some of our community advisory board leaders on the call, which is wonderful. But we are really trying to reach out to the community, bring them in, and help us identify issues that need to be addressed in the community, and how can we develop, toolkits, resources in a box, things that they really need, that we can give them. And we could go out and give it to them, we can hand it to them, whatever. But we started with schools because that's where we've been working for a really long time, and to create some kind of a kit, a health kit for schools that they need. But it has to be together. And that's Darius's point, I think, is a lot of times we as researchers go in and say, oh, look, we've got something for you, or we want something from you. And I think what we're all doing a lot more is working with communities and community organizations to really understand what their needs are and how best we can help address it, and partnering with them in that way. So those are a couple things. And then identifying different communities and forming partnerships. So again, there are other resources at Northwestern that work on the community. The ARC is a great resource. So working with other Northwestern centers or sites that are working in this area, for all of us to work together to really see how we together can impact the community by listening to them and giving them, helping them, together, working together to improve care.
Yeah, I think I would add too that, I'll boldly say that, as proud as we all are of how far Feinberg has come and our contributions in terms of helping our partners to collect data, understand data, use the power of research to help inform thoughtful decisions in the community. It's never Feinberg faculty that are solving these types of fundamental problems. We strive to work with the folks that are the doers and the actual, these are agencies that determine, safe and affordable housing conditions, or invest in local, businesses, or public safety, or other social determinants. Food security was brought up earlier. The safety of physical activity. There are things that that have to happen structurally in policies throughout multiple sectors that we frankly can't possibly control. We don't have the power to make those decisions, but we have we have knowledge, we often have a seat at the table, we often have privilege of being Northwestern faculty members that gets our foot in the door in important conversations. And it is, I think, our responsibility to work collaboratively. We take it as our responsibility to work collaboratively so that we can put the right data and information into the hands of people who can solve the challenges. And we try to understand them more deeply by engaging before we do the research. We try to do research on things or embed in our training the types of activities that are going to turn back to the community future leaders and future people who will work out there. But us as Feinberg faculty aren't the actual, when we do a research trial, it's not the trial that solves any of these problems. And unfortunately, traditionally research wouldn't even get into the hands of the people who are actually making these decisions or in a position to make changes at a community or structural level. So we try to be at the table. We try to be, in a balanced way, provide all information we can in ways that those individuals who aren't researchers or don't teach in an academic setting can use the information to do their work and do it in a way that's far more impactful. So, humbly, I'll just say that, we strive to make these impacts, but our role is small, and it's really a facilitating and empowering role of those who really do the work. So it's so important to build these structures that build on partnerships and allow us to really co-develop and co-design our research and center it on the needs of our community partners. And I'm afraid that a lot of times we're still not doing it quite as well as we should, but that's, I think, the role we've had. There was one question about embeddedness in the city Department of Health and how it's making decisions. And I think that is a good example. I mean, there's a place where we have collaborated for years and try to have our trainees have embedded experiences in the health department to learn how the health department works and makes decisions. And maybe while they're there, collect data and do small research projects that help the health department and bring us into a closer relationship. We've, as I've said before, had some faculty move over, take a leave here and actually spend time at the Illinois Department of Public Health. And now Nick Soulakis is a deputy commissioner and chief informatics officer at the City Department of Health. The models we've, used on public data and on sort of data that we've been able to string together. Some of our centers are data scientists, and they've been able to connect data sources from hospitals and local communities to really get into detail about the more granular effects of the pandemic on local communities or in different regions of the state. And they've created dashboards that are being used by the city, by the governor's office, by the mayor's office. We're not the only partner there. There are other academic institutions, and a lot of those public agencies want to see, that they don't have favorites necessarily, and they want to look at what they're hearing from multiple academic or research or data sources. And so we collaborate with other academic institutions in that work too. But we've worked a lot with the city in trying to inform their Healthy Chicago 2025 strategic plan. Some of our centers are involved in that. A lot of that, was developed before the pandemic and doesn't talk about COVID-19, but COVID-19 amplifies many of the health disparities and health priorities that were already outlined. So as we continue, that the city continues to move that agenda forward to address other health areas that are just so pivotal and important in the city of Chicago to public health and health equity. We're collaborating, trying to align research strengths with that, trying to embed trainees, and trying to collaborate in helping our community partners to engage in that as best we can. There was one question, Ruchi, about how you're collaborating with Lurie Children's. You mentioned that on a few slides, but there's a question about Lurie Children's, and then as part of that also, does it reach homeless children or families who might not have access to health services or the wonderful resources of a place like Lurie Children's? Can you talk about that?
Absolutely. We collaborate very, very closely. The center is actually built between Northwestern and Lurie Children's. We work very closely with kids. I'm a pediatrician at Lurie Children's. So we work together on pretty much every study we do. So it is a full bridge, Northwestern and Lurie Children's. And access is very important. So Lurie Children's has primary care clinics that, and I work at one of them, that are Medicaid, predominantly Medicaid clinics. And so they do serve the underserved. There's one in Uptown and one at Clark and Deming. And we do go into those clinics and work specifically on the food insecurity questionnaires. They've all been installed in both clinics to really understand how many kids families have food insecurity. That's one of the big things that we're working on with them. We also, as part of our other NIH trials, reach out and work with Alliance, which is FQHC, a federally qualified health center across Chicago, multiple sites, and really serves the underserved. And so they are also a part of many of our studies, and I think other Northwestern studies, to help in certain areas. So we are working with them on that whole prevention study, because we want to make sure some of these studies that were done, even looking at peanut introduction, were done in the UK, and they were not done in a diverse community. Really, it was who could come. And so it was not, there were very few Black or pretty much no Latinx and not many low income kids in those studies. So we are very focused on making sure that happens. We work with Alliance, and then other FQHCs we try to reach out to across Chicago. But Lurie Children's, we definitely, they are the ones who help us, make all this happen along with Northwestern.
Yeah, so we're getting to the top of the hour. There are some questions we haven't been able to get to, and we'll try to organize some responses, I think, and send them out. I wanted to ask one last question that came from an anonymous attendee that, and maybe if Darius takes a minute, Richie takes a minute, just to reflect on this, and then we can turn it back to Dave to close. Really briefly, we've described a lot of things where we pivoted or did things differently and virtually and worked in different ways because of the COVID pandemic. It's deepened relationship with community partners and taken us in new directions. Is any of that permanent? What have we what will we take from that and make permanent, and how has it changed us as an institution leading forward?
I think it has raised our awareness of different ways in which we need to be communicating and reaching out to partners. So I think we now have an ability perhaps to be communicating more efficiently, communicating in more sort of nimble ways. I think that is a strength. So, I think that there are some lessons that we, frankly, are still learning from this pivot. And I think, it's going to require a little bit more reflection on how we can then sort of integrate that into our workflows. But, I give kudos to, our team at the Center for Community Health. We are very much, I think, in tune with, where communities are and what communities' needs are, and have done a lot to try to understand what community needs are in this time of the pandemic. So, I think those lessons learned are things that we're going to, be digesting and thinking about how they would support our work longer term.
Yeah, I totally agree. Center for Community Health, IFAM in general, I think all of us, have learned a ton through this past year, and these initiatives that were not usually part of research institutions, right? We don't give out community grants. That's not a normal thing. We do research. And so the fact that we were able to come together and say, this is important right now for our community, and we need to do this. And the fact that a lot of those, were also turned into research potential endeavors or long-term partnerships has showed us, and I think we'll continue to do this, that how important it is to reach out as a research institution or as a university even to the community, and not have it all be about what we know, right? What we've already done, what's tried and true, but to think outside and to be there where people need you in whatever capacity you can, and then, bring them in and make them part of your community and your research endeavors. And so many new ideas came from them, so many areas of research that are so needed. And we're going to definitely continue, I think all of us will, to keep that as part of our core, to keep reaching out and increase, our participation in the community.
Dave, you want to take us to the close?
Ron, Ruchi, Darius, thank you so much for the informative discussion. More importantly, I think we're all grateful for the work you and your colleagues do for us through the Institute to advance healthcare and its delivery. To everyone who joined us this afternoon, we extend our sincere thanks. Your interest in this important field speaks volumes about you. We'll be sending all of you, our registrants, an email containing links to this video discussion, as well as to the Institute for Public Health and Medicine's website. My email also will be included. If you have questions which are not answered, like Ron said, we'll do our best to route those to the appropriate person and get back to you. And one final important point, philanthropic support can make a tremendous impact and substantially advance the work of the Institute. Please email me if you'd be interested in having a conversation about ways you can help. Have a wonderful evening. Thank you.
Thank you, everybody.